Are lumbar stenosis exercises the same as bulging disc exercises? If not, what's the difference? That's the question I got asked by Dennis, who watched one of my lumbar stenosis exercise videos right here in my YouTube channel. After treating thousands of patients over 35 years, I've seen the biggest mistake come from confusing lumbar spinal stenosis exercises with bulging or herniated disc exercises. In this video, I'll clearly break down the difference between the two types of exercises, show you which exercises match each condition, and give you confidence that you're doing the right movements for your spine. And at the end, I'll answer another question almost no one explains clearly: what to do when lumbar stenosis is caused by a disc bulge or disc herniation. The solution is simpler than you think. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. I've been doing this for over 35 years now. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash that subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs, without surgery. I upload a new video every week. So here's the first thing you need to understand. Lumbar spinal stenosis exercises and bulging disc or herniated disc exercises are not interchangeable. If you treat them like they are, you can easily make leg pain and back pain worse, even though you think you're doing everything right. This is one of the most common reasons people feel stuck, confused, or afraid to move at all. Both conditions can cause very similar symptoms: pain down the leg, tingling, heaviness, weakness, sometimes even numbness. That similarity is what creates the problem. People search for leg pain relief exercises and end up doing movements designed for the wrong condition. The body responds immediately. Symptoms increase, and then fear takes over. Here's the key difference. Lumbar spinal stenosis is usually what we call a space problem. The nerves are crowded, especially when you stand upright or arch backwards. A bulging or herniated disc is usually a pressure problem. When you bend forward, the disc can move further back towards the nerve, which often makes leg pain worse instead of better. So again, think of a jelly donut. If I'm squishing one side of the jelly donut, the jelly is going to be coming out the other side. That's what a disc bulge or disc herniation is all about. You get the same leg pain, but opposite solutions are required. Now, here's an important point to remember, and we'll come back to this later in the video. Pay attention to what your body tells you when you move. The right exercise is the one that improves your symptoms, not the one that makes them worse. The correct exercise should reduce leg pain, centralize symptoms, or at least not make them worse during or after movement. If leg pain travels further down the leg, becomes sharper, or lingers longer after an exercise, that's your nervous system telling you the movement is wrong for your condition. Most people are never taught this. They're told to strengthen their core, stretch their hamstrings, or just stay active. But without understanding which condition you're dealing with, those instructions are incomplete and sometimes harmful. The goal is not to push through pain. The goal is to choose movements that gives the nerve relief. So before we talk about any specific exercises, you need this rule locked in. Direction matters more than effort. Symptom response matters more than diagnosis labels. And clarity always comes before intensity. Now that you understand why these exercises are not the same and why mixing them up causes so many problems, let's move into the first category: exercises that typically help lumbar spinal stenosis and why they work the way they do. So when lumbar spinal stenosis is the main driver of your leg pain, the movement that usually brings relief is forward bending, also called flexion. So flexion simply means rounding the lower back or bringing your knees towards your chest. You're bending forward. These positions open up space around the nerves, which is why many people notice their leg pain eases when they sit down or lean forward. This is why stenosis-friendly exercises are built around flexion-based movements. A seated forward bending movement is a simple place to start. Sitting and gently bending forward often reduces leg symptoms within seconds. A seated knee to chest stretch works in a similar way by decreasing pressure on the nerves. A seated pelvic tilt, when done in the right direction, helps you control this motion in a safe, low-effort way. And for many people, the 90-90 relief position is one of the most common positions for leg pain because it keeps the spine in a flexed, supportive posture. I have several videos that demonstrate these lumbar spinal stenosis exercises step by step so you can follow along safely. I will link a few of those videos below in the description area. What you typically want to avoid with stenosis are extension-based movements. Extension means arching the lower back or bending backwards. Exercises like prone extensions or standing back bends can further narrow that space around the nerves and often increase leg pain. which leads us directly into why those same movements are sometimes used for a completely different condition. Now, when leg pain is coming from a bulging or herniated disc, the movement that often brings relief is backward bending, also called extension. So extension means gently arching that lower back. For many disc-related conditions, this movement helps shift pressure away from the nerve and can reduce leg pain when it's done correctly. This is why disc-focused exercises are often extension-based. So remember, these two exercises are the exact opposite of one another. Prone lumbar extensions are a common starting point where you gently press up while keeping the hips relaxed. Standing extensions work in a similar way and are really easy to repeat throughout the day. A lateral hip shift, which really isn't an extension movement by itself, can also be very helpful when symptoms are worse on one side. Seated pelvic tilts, again, when done in the right direction, allow you to introduce extension in a controlled, low-effort way. And that old cat-camel movements, very well-known, help restore motion while letting your symptoms guide how far you go. I have several videos, again, that demonstrate these lumbar disc bulge or disc herniation exercises step by step so you can follow along safely. I'll also link some of those videos in the description area below as well. What you typically want to avoid with a disc bulge are flexion-based exercises that we've been talking about. Movements like abdominal crunches or sit-ups, contrary to you thinking you're strengthening your core, actually push the disc further back and irritate the nerve. Exercises that heavily load the spine, such as press squats, deadlifts, or barbell squats, can also increase disc pressure and delay recovery, especially early on. When you see how opposite these movement strategies are, it becomes clear why using the wrong exercises creates so much confusion, which sets us up for the next and most important piece. Now let's talk about the situation that creates the most confusion. Sometimes central canal stenosis is caused by a central disc protrusion, a central disc bulge, or even a central disc herniation. So you may have both coming on. One may in fact cause the other. You may have even read those exact words on your MRI report, and this is where people get stuck. It is certainly possible that you're suffering from both stenosis and a disc bulge or herniation at the same time. You then start wondering, well, which type of exercise am I supposed to do if they're the opposite? You try flexion-based movements for stenosis, but worry about aggravating the disc. You try extension-based movements for a disc bulge, but worry about creating less space around the spinal nerves. That back and forth uncertainty keeps many people from moving at all. The answer is simpler than you think, and we talked about this earlier in the video. Now, of course, it's always best to see a qualified health professional who understands these issues well. Not all of them do. But if you can't, you test them both carefully and calmly. Then you do the one that gives your back and your leg pain relief. Okay? It really is that simple. Pay attention to the body and always do these exercises very slowly, very carefully. Now, always remember, nothing is set in stone. There is no single exercise that is right for everyone, contrary to what you might see, on YouTube, on the internet, where the best low back exercise for everyone. That doesn't exist. Right? What always matters is how your symptoms respond. You continue with movements that reduce pain, centralize symptoms, or leave you feeling better afterwards. And you avoid movements that aggravate pain, spread symptoms further down the leg, or leave you worse later. That old adage, no pain, no gain, never applied to what we're talking about here. For some people, flexion-based movements will clearly bring relief. For others, extension-based movements will do a better job. Your body gives you the answer if you know how to listen to it. That clarity is what removes fear, builds confidence, and allows you to move forward safely. I hope you now have a much clearer understanding of when extension-based exercises make sense and when flexion-based exercises are the better choice, and that you can see why exercises for lumbar spinal stenosis and lumbar disc bulge are, in most cases, very different and, in fact, the exact opposite. Make sure you watch the exercise videos I posted in the description below so you can see clear demonstrations of each exercise type and follow along safely. If you found value in the video, please like it. Please share it with someone who may be struggling with the same confusion. And if you have a question, drop it in the comment section below. I read them and do my best to help. And as you've seen, some of those comments we actually turn into videos for future help. Also, consider subscribing to the channel if you want to learn more practical tips and strategies for relieving back pain and neck pain without drugs, without surgery. Thank you to Dennis for posting the question, which we've now turned into the video for you. And when you're ready, the next video to watch is called 5 easy to do exercises for lumbar spinal stenosis. Go watch that video next, please.